We have historically 24 programs here at the Sports Center, adding 3 more that we'll announce tonight at the award ceremony. But Audrey and Erica were part of a very important one called the Innovation Scholars Program. It's high potential undergraduate entrepreneurs who get a deep dive immersion in the ecosystem here in Pittsburgh, New York City, and Silicon Valley. People like Matt Mittal from Trainwell, Stella Hahn from Fractional, were all innovation scholars who've gone on to raise hundreds of millions of dollars at huge valuations. So hopefully our team from GoRide will do that. Our next competitor is noVRel.
Hello, everyone. My name is Tanvi Mittal, and I'm the COO of noVRel. We're redefining the operating room. Did you know that 20% of all neurosurgical procedures result in a mistake? And for every 30 minutes of prolonged surgical time, there's an increase by 14% in the chance of a complication. Now, there are 3 main tools surgeons use in the operating room during a routine brain tumor resection procedure: visual magnification loupes, OR lights, and a fluorescence-guided microscope. Yet each of these tools have major drawbacks. Loupes are magnification glasses, but they have a fixed level of zoom. This means surgeons have to switch between them multiple times throughout the procedure, disrupting their workflow. OR lights are essential in illuminating their field of vision, yet they can often drift out of place or be blocked entirely. And a fluorescence-guided microscope lights up the tumor like Christmas lights, yet it can take over 15 minutes to sterilize and calibrate before every use. Now, I've talked through the problems with the current OR suite. What about a solution? From diagnostics to pre-surgical planning, surgeons rely on augmented reality. But what about the intraoperative world? How can a surgeon wear an AR headset and all of their other current operating gear? We've interviewed over 85 surgeons, and their opinion is unanimous. noVRel is redefining the operating room for surgeons like Ted. Ted wants a device that he can use from the start to the end of his case. He wants noVRel. At noVRel, we're developing a hardware attachment that allows surgeons to utilize augmented reality from the start to the end of their cases. With an AI-enabled camera, intelligent lighting, and retractable light filters, we are consolidating key surgical tools into one compact device. Now, augmented reality can enhance surgical precision by creating visual overlays into the real world. We can deliver real-time patient data and intraoperative streaming, allowing surgeons to have unlimited control right at their fingertips. The possibilities are truly limitless. As you can see here, these 2 OR suites are completely different. The traditional OR suite is incredibly chaotic, but our proposed OR suite completely gets rid of this. We're not replacing instruments, we're consolidating them with our device, allowing surgeons to have a more efficient workflow and all of the tools that they need right at their fingertips. Now, after all this, you might be wondering, we're making surgeons happy, but what about the hospital? Our device consolidates these 3 key tools, eliminating the need for their costly replacements, allowing hospitals to experience long-term cost-saving benefits. And time is money. Did you know that every minute in the OR costs hospitals upwards of $90? We estimate that our device can cut down 30 minutes per procedure. That means high-volume hospitals can conduct nearly 3 additional procedures every day. Looking at our competitive analysis, we have found no device on the market that does what we do. There is no device that takes in these 3 key surgical tools and also offers the benefit of augmented reality. Now, it's said that by 2026, every hospital in the United States will use augmented reality in some fashion. So if we target just the 15,000 ORs that are high-volume hospitals that already employ AR specifically in neurosurgery, we have a serviceable, obtainable market of over $424 million. After market entry, we plan to hit 2,000 ORs in our first 2 years. With our attachment being sold at $23.5K and our hardware support membership, we project a revenue of $72 million in the first 2 years. We will present noVRel at trade shows and conferences to connect with passionate surgeons that can advocate on our behalf to their hospital systems. By presenting quantitative data to supplier departments, we can enter key partnerships and explore licensing pathways to fast-track our growth. Our IP has been filed, and we are looking into European expansion currently. Our IP covers the 3 surgical tools along with our hardware clip attachment.
Okay, we have to stop right there and hand it over to the judges. Please just dive in. Survival of the fittest, first come, first serve. Go for it, Matt.
Hi.
Ben Hoffman, you're next.
I don't understand one aspect of what you described. So hardware element for sure.
Yes.
But is this merely lighting and magnification, or is there guided software and data, and where are you getting that, or do you have to write it, if that's the case?
A great question. We didn't want to become a software company. There are several softwares out there that provide such tools that med students are already being trained on. So instead of competing with them, we want to explore licensing with them, where we can provide our hardware aspect, and of course we'll have like some caliber of software that integrates all of these tools, but the actual navigation will be done using the softwares that surgeons are already used to that are on the market. Yes.
About your milestones?
Yes, thank you for asking. So for our next milestone, we hope to conduct a comparative study using our Apple Vision Pro prototype that's right here, along with our HoloLens prototype that is pictured in our slide. We've invited 4 key opinion leaders that are surgeons at UPMC that will give us their feedback on both devices so that we can continue developing and hopefully enter a design freeze and manufacture. Yes.
Have you thought about partnering with an existing hardware,
Yes.
a Siemens, I'm rattling off, right?
No,
A GE?
absolutely. So we have talked to several med device companies and also the augmented reality companies, right? And what we've found is that they just need to see a little bit more fruition. So we're hoping with comparative study, we can establish some paperwork that shows how accurate our device can really be. So Microsoft, with their HoloLens, worked with Trimble, which is a construction company. Trimble had created a similar hardware attachment for construction purposes. That Trimble is now sold on Microsoft's website. Microsoft takes care of all of the manufacturing. So something like that would really help fast track our growth. So it's something we're definitely exploring.
So how do you ensure the accuracy, because you're overlaying the visuals and AR?
Yes, so that's something within pedicle screw replacement surgery. There is a lot done with augmented reality right now, and so what we've found is that there is a 96% accuracy using FGS in pedicle screw. So we still need to go through like testing, and going through our comparative study will get me more numbers for you, but we're pretty confident that that wouldn't be an issue for neurosurgery either.
Could you go back to your addressable market slide, if you don't mind?
Which slide, sorry?
The addressable market?
Yes.
Got it. So how many neurosurgeons are there in the United States that could potentially use your product?
That's a great question. I unfortunately don't have that number right off the top of my head. But as written on this slide, there are around 15,000 ORs that are used at high volume hospitals for neurosurgical procedures. And so using that estimate, there's a large market. We also don't want to limit ourselves to neurosurgery. We found that neurosurgeons are the most open to adopting new technology, but after we bridge into that market, we really do hope to expand to cardiothoracics and every other market in surgery as well.
Have you thought about, I get you don't want to do the software part, but you are going to have to, hardware and software, right, have to work together. So
Absolutely.
have someone that understands how to make that interface work.
Yes. So we do have some people on the software end working with us to develop our device to have all of the UI ready for a comparative study. And so we are exploring that. We are also just being very honest in that we are not a software company and we will not be developing our own proprietary surgical navigation software. So we will work with like Augmetics and other software companies out there to ensure that our device works with their software.
So you showed the light and the camera being replaced, but there was a $950,000 microscope being replaced. What's that part of the solution?
Yes. So let me start back at the beginning. So as you can see on this slide, this is a fluorescence-guided microscope. 7 feet tall, 800 pounds, huge device that is wheeled in and out of operating rooms. And essentially what this does is it illuminates the tumor like Christmas lights so surgeons can see it better for increased visualization.
All right, we are at time. Thank you very, very much.